Here in Atlanta, we're starting a very exciting program. It's called Well Transitions, and what we're doing, we're integrating our services into the hospital to help them improve patient outcomes, and this is through medication adherence and transitioning the patient out into the community. The components of the program involve medication reconciliation, medication validation, and then discharge planning before the patient's actually going home. Once the patient's identified to be in the program itself, medication reconciliation will begin at that point after we've got the patient to consent into the program. And what we do then is we run a medication list, and we pull that from a data system that pulls in about 95% of the prescription data out there, and we compile the list into a clean list. And what we do is we use our clinical judgment to decide what the patients are currently on and what they're taking, and then we take that down either to the emergency room or to the nursing staff for medication validation. What we're hoping to do is to decrease hospital readmissions. Many readmissions are caused by patients not understanding how to take their medication properly or actually not getting their medication filled before they leave the hospital. So with Walgreens delivering the prescriptions to the bedside, we're ensuring one step of the way that they're actually getting their medications, and then we're actually educating them also before they leave the hospital so they know how to take their medications. Once discharge is planned, what we do is we take the medications up to the patient's bedside upon discharge. That way when they go home, they already have their medications. We do a post follow-up call, usually 2 days later, and then what we do 25 days later is we help the patient transition out into the community, and then what we do is we measure outcomes. My role as a pharmacist is changing. It's actually evolving with this program because it's helping me to get out from behind the counter and work directly with the patients one-on-one. It's increasing my interaction with other healthcare professionals like nurses, the ER staff, hospital administrators, and physicians. And they're looking at me as a team player, a vital part of their role in helping patients be well. Physicians are happy that we're taking part in this program because it's actually decreasing their workload. They feel confident they're sending their patients home educated on how to take their medication, and they're looking to us to help follow up with them, make sure the patient is seeing their physician in a timely fashion. Patients are super excited that we're involved in their care. They're seeing a pharmacist as not just a person putting pills in a bottle, but actually talking with them one-on-one. So we are becoming a team player in helping them live a better life, a healthier life. And it comes back to the Well Transitions program. We are transitioning the patient out into the community and helping them to be well and be healthy.